This current part focuses on ethics. This particular module asks, how can we practice ethically in an area so marred with problems and complexities? While it's difficult to tell practitioners exactly what to do in diverse practice situations, we can offer some general ethical principles to guide your decisions. We do so tentatively. If you ground your practice in ethical principles, you're more likely to make good collaborative decisions, to justify your decisions publicly if you need to, and to advocate for your clients too.
This course was designed to improve your professional competence around psychiatric medication. Competence results from education and training, consultation, supervision, and continuing education. Knowledge increases confidence and empowers non-medical professionals to participate fully in multidisciplinary environments. However, knowledge comes from education, not indoctrination. It is difficult to know how to act in a child's best interests. Juvenile courts struggle with these issues regularly.
Consent isn't about getting a client to consent to medication treatment. Consent is grounded in principles of self-determination and empowerment, and it's an ongoing process of providing complete, accurate, unbiased information, of weighing the pros and cons of different intervention options, and supporting unique clients in whatever decisions they make for their lives. If we remember that people can and do recover and thrive with or without the use of medications, we open these possibilities up for our clients and truly can support them in their paths towards living a fulfilling life, whatever that looks like for them. We have to get past a focus on medication compliance and getting clients to consent in favor of providing accurate information, clarifying options, and strengthening choice.
Undue influence can happen when you apply pressure for a client to take a medication because you believe it's the best option for them. This is where your respect for the client's self-determination requires careful exercise. In youth, assessment of competence considers intelligence and cognitive functioning, maturity, impact of any distress, and the seriousness of the situation. Younger and older children may have the capacity to provide fully informed consent, and it is an ethical duty to involve them and their parents as much as possible. The failure to provide adequate information to clients invalidates any consent that they provide. There are many reasons some people don't want to take medications prescribed to them. The most common reasons are because the drug isn't working very well from their perspective, or the drug's adverse effects are intolerable. Sometimes children are not able to express their reason clearly. Sometimes we might not understand the reason. Still, if they are competent, they have the right to refuse treatment or withdraw consent at any time after having given it. Whether we agree or disagree with a client's choice about medication, our professional code guides us to respect the client's right to self-determination. This is important because a substantial proportion of clients discontinue drugs that are prescribed to them for reasons that make sense to them. Medication effects go beyond the psychological and extend to the interpersonal and developmental. To understand effects on identity and relationships, practitioners should begin by listening to children. Sometimes we wrongly assume that caregivers are fully able to advocate for and act in their children's best interests. This underscores the importance of listening to children's own perspectives.
First, do no harm is one of the oldest and most fundamental ethical practice principles of medical and non-medical professionals alike. It guides us to ask a key question in each instance. Are we sure that we're doing no harm to this person? It's not solely up to the doctor or the prescriber to determine this answer. Everyone tasked with helping someone or tasked with merely facilitating that help needs to ask this question. For psychosocial professionals, it involves looking comprehensively at the biopsychosocial well-being of the child and how drugs may be affecting each of these levels: biological, psychological, and social. We encourage all helping professionals to ask and reflect on this question in each and every one of their cases.
This entire course brings us to the following conclusion. Psychotropic drug use should be avoided in young children until all psychosocial interventions have been exhausted, rationally anticipated benefits outweigh the likelihood of harms, parents and guardians are fully informed, and close monitoring is in place. Professionals working with children who receive psychotropic drugs must take responsibility for their education and be accountable to clients and society for their own decisions about medication-related issues. Grounding your practice decision in time-tested and consensual ethical principles is the best strategy to ensure effectiveness and reduce harm. David, what advice do you have for professionals striving for ethical practice in this area?
Practitioners have an ethical responsibility to balance potential benefits with potential harms and discuss both with parents and older children to obtain informed consent from both. Given all the known risks associated with psychotropic drugs, attempting psychosocial therapies to treat problems in children prior to considering medication is, in my view, an ethical and clinical priority. Given that so little is truly known about the long-term effects of psychiatric drugs in children, can anyone ethically reassure clients that their medications are safe, This is why fully informed consent and self-determination are essential.
Shannon, what advice do you have for psychosocial professionals committed to advancing ethical practices in their agencies or organizations?
After a system of care has long encouraged a certain practice, an inertia sets in, and questioning business as usual becomes often difficult and scary, especially for beginning practitioners. Promoting ethical practice starts with courage and persistence. Ask good questions, and always bring conversations with colleagues back to their ethical grounding.
What kind of questions do you think are important to ask? What would you ask your colleagues?
I would ask, can we be sure here with this child that we're not doing harm? Do the parents fully understand the benefits and risk of what's being proposed? Do we ourselves understand fully these risks and benefits? Are we respecting this adolescent's right to participate and determine their treatment options? These are all bedrock foundations of professional practice, and there are obligations in our contract to practice as professionals in this society. Ask these questions and role model them as you consider making a medication referral or as you advocate in front of a judge.